All right. Good to welcome everyone to the Public Safety Appropriations Subcommittee, and we've got a few items to go over this agenda. We've had some very long afternoons. I anticipate that we'll probably have some additional long afternoons, but I don't want to waste members' time, and they'll be coming. Some people have bills to present, so we'll go ahead and start taking information. We're going to have members that are coming in that had some lunch meetings with constituents and a couple of bills in committee. So they're going to probably be trickling in during the presentations, and I ask for your pardons over that. And with that, I'd like to go ahead and start off with you're going to present?
Yes, sir.
Neil is not going to come and present?
No, sir. He actually, him and his wife have a personal matter they're having to take care of today, so he's unable to be here, and he sends his apologies from us.
Let me turn that on. Okay, you said. Well, thank you, and I'm sorry. I hope things work out.
Yeah,
for
everything's
the
fine.
Commissioner, and everything goes well with him. But we're going to go to the Department of Community Supervision, and we will turn to section 18 of your track sheet, and we'll start off there. If you're following in your big budget book, that's page 135. And we appreciate the Commission being here. We appreciate the service of your men and women, your department. And I'm going to let you go ahead and present the budget. Now, I know I've got your presentation here, and I'm happy for you to extol the virtues of the department. But we have some significant alterations in your previous year's budget to this year's budget, plus looking at the amended. So I do want to spend most of our time on that.
Okay.
And so that we have time for questions from me or Chairman Green.
Yes, sir.
And whoever else meanders in, like Chairman Powell.
So I know that you are very familiar with Department of Community Supervision and the large number of individuals under supervision with our department, as well as the fact that we lead the nation with the highest caseloads, as well as length of sentence while under supervision. So I won't spend a lot of time going over that. I will say that as far as our budget reduction plan goes, we really focused on three areas: operational efficiencies, strategic workforce management, and evidence-based decision-making. And we did that while keeping in mind that our statutory obligations as an agency. So if we move to, we'll go to, and I'm sorry, mine does not have page numbers on it, but the next slide is just a brief summary of the
Budget reductions?
budget reduction summary. Yes, sir.
Yeah, good.
Amended year fiscal year 2020. Those reduction amounts are reflected there in those four areas of focus for the agency. And then the next slide, focus areas of reduction. Just very briefly, under operational efficiencies, what we targeted was reducing office supplies and travel, as well as reducing physical footprint by emphasizing a distributed work model. Renegotiate contracts where feasible. Our second target area was strategic workforce management. Create centralized position pool and staffing allocation model, as well as shift from a case count to a time-based supervision model. And then lastly, under evidence-based decision-making, eliminate all of our non-statutory functions and consolidate internal and external duplicative functions.
Okay, so let's talk about the freezing of your vacant positions. Looking at line 18.1.2 in the amended budget, there are 4 vacant positions that are being frozen. Is that correct?
Under administration, yes, sir. There are four positions that are being frozen for a total of $254,000.
I'm sorry. Yeah, it's section 18, page 7, and of both of the budget track sheets. So now we're looking at this here. What I want to go over with you is the number of vacant positions of those that you're freezing, the 4 that you're freezing, which means there won't be any funding for those positions should anybody become available to hire. And,
yes, sir.
And with those 4, how long have those been vacant positions?
Those positions have been vacant for probably an average of 6 months.
Okay. And how many additional vacant positions do you have in administration?
That is all of them.
That's all of them? Okay.
Yes, sir.
And so for what reason can you explain to the committee why those have not been filled?
So In relation to all four of those positions, these are positions that through process improvement as well as eliminating some duplicative servitives, when we initially got the budget reduction, we targeted those four positions as positions that we could freeze and not rehire and be able to continue the same service delivery as we have in the past within the administrative budget.
Okay. On field services, we have the same thing at line 18.2.3. We have a freezing of vacant positions for $4.3 million.
Yes, sir.
So explain to me how many positions we're talking about.
So that is a total of 76 positions. 26 of those positions are community supervision officer positions for $1.6 million, and then the other 50 are non-sworn positions. We currently have 44 vacancies that we're, in addition to those that we're holding, 44 vacancies that we are in the process of hiring.
And when you say process of hiring, what does that mean?
So they are anywhere from probably vacancies that we've realized in the past 30 days to a couple of them are probably 60, and I think maybe one or two of them are a little bit above 60 days since they're in the process of being hired. So most of them have been posted. We're in the hiring process, and the majority of those are sworn positions.
And then you said the 50, I didn't catch what kind of positions those are.
Those are all, 50 of those, the total is of 76 positions in field services. 50 of them are administrative positions. The bulk of those would be admin staff. Mm-hmm. Some of them are counseling positions, and then 26 of them are community supervision officer positions that are being frozen.
Are these counseling positions that we had allocated before to assist with, and we were transitioning, I think, some of the administrative assistants back in sort of a quasi-field role, and since they were with the court systems, providing an on-site counseling and
so those are, you're referring to the appropriation last year for the court specialist positions?
That's correct.
Are not included in those positions. Because those court specialist positions have been extremely key in allowing us to move 49 positions that were in court, working court, back into the field to supervise caseload. So those 49 positions are now actually working a caseload, supervising the caseload, working in the field as a CSO. Okay. As well as the fact that those positions are taking a lot of the administrative functions that previously were tying up officers' time in court. They're no longer having to spend that time in court because those court specialists are taking over that function. So they can dedicate their time to the field supervision.
Okay. And have those 49 positions been filled?
Yes, sir.
Because there were administrative staff that were moving to the field, or counseling that were moving to the field, right?
Correct.
Okay, good. All right, let's make sure we're holding the line on that, on last year's decision to authorize that change.
Yes, sir.
Okay, and then you have, you're transferring 11 community supervision officers at line 18.2.6, and that's going to go down to field, is it going to field services, or how's that moving?
I'm sorry, yeah. So every one of those positions has been transferred to a full-time CSO position. So we eliminated the MORE program. We eliminated the officers in the transitional centers. They no longer work in the transitional centers as part of the MORE program. Mm-hmm. Those officers are now working in the field, okay, carrying a caseload. And all 11 of those positions have been transferred.
They have. Now, if I recall correctly, was it about 30 positions total that we created to assist with helping the folks in transition to find housing, work placement, and then some miscellaneous assistance. And I'm ballparking that.
Those are the Georgia Prison Reentry Initiative positions, yeah, that have been associated with that pilot project. And so, yes, there's a total of 35 of those positions, okay, that we're currently eliminating as part of the reduction.
So you're eliminating all 35 that we had allocated 2 years ago, I think it was?
So it's been, over the course of several sessions, we've allocated, so that it started off as a pilot, and then we expanded to 17 sites. Last year, our initial ask was for 20 positions. We were funded for 10. Okay. And so those 35 positions, yes, they're all being eliminated. Now, that does not necessarily mean that the prison reentry model is not still part of our supervision plan. So we have 17, the original 17 pilot sites are still in existence. We have community coordinators at each one of those sites that are taking on the responsibilities of some of the in-reach coordinators as well as housing coordinators. And so they're still able to deliver the services that were associated with the success of the prison reentry initiative. I mean, those 17 pilot sites. What we are not doing is expanding to the additional 5 sites that we asked for appropriation for last year, and then eliminating 5 housing coordinators, 3 faith and justice positions, 19 in-reach positions, 3 admin positions, and then the expansion of the 5 that were funded last year. However, those people that are on those...
Could you repeat that one more time?
All the positions?
Those lists.
So it's 5 housing coordinators, 3 faith and justice positions, 19 in-reach positions, and so those were the positions that were actually in the prison systems working inside the wire, 3 admin positions, and then the 5 community coordinators that were part of the appropriation last year for expansion.
Okay.
However, those people, their positions are not necessarily being eliminated. They're being allowed to apply for vacant either CSO or counselor positions, and so currently we have 11 that are still on their position. We've given them until March to find a position within the agency that is funded that they can apply for, or if they determine they would rather leave the agency. And there has been a few that have left the agency, but the majority of them have applied for either a CSO position or a vacant counselor position and been hired on those positions because they are funded.
Is that an administrative directive that Commissioner Nail has put forward, or is that being directed by somebody else?
Commissioner Nail, yes, sir.
Okay. And in doing that, what is the thinking in terms of the impact for helping people transition into society from prison? What impact do we think that this is going to have in terms of the success rate of those making that transition and not recidivating back into the prison system and becoming another, additional burden on the citizens of the state?
And that's an excellent question. If you remember correctly, last year as part of our proposal, we submitted an evaluation that Applied Research Services did. That evaluation showed that there overall in the pilot sites there was a 14% reduction in recidivism. That was as a whole. They took all those different positions into account. But if you looked specifically at each position individually, the one position that had the biggest impact were the community coordinators. If you back up to where the Prison Reentry Initiative model initiated with the Criminal Justice Reform Council, the initial model called for an in-reach coordinator, a community coordinator, and a housing coordinator at each one of the pilot sites.
Right.
Over time, some of the functions of, for example, of a housing coordinator, establishing housing relationships, building capacity within the community, those functions over time started to go away, and the community coordinator is able to absorb those functions. We have a great working relationship with DCA as part of our reentry partnership housing. They continue to build capacity as far as housing goes across the state for our offenders. So we feel very strongly that even with the elimination of these positions, those community coordinators that are still in place in the 17 pilot sites will be able to continue the service continuity that they previously had delivered, and that resulted in a 14% reduction in recidivism. And in reference to the in-reach coordinators, they were positioned in the prisons. And I'm glad to see Department of Corrections here today. We've had conversations with Commissioner Ward about the fact that they have reentry counselors in the prison system. And one of their main functions and goals is to work to prepare those offenders that are releasing from prison into the community to make sure that the resources that they need are available in those communities. So we still have 3 positions dedicated to making sure that that handoff between prison and community is still there.
Okay. And then, so part of this is once you start to develop the housing, the system and the knowledge of where housing is available and how that turnover may be addressed with inmates that have come out and they're in transition and they're moving back out, and they may keep that place and may move some other location. Once you've kind of established that, that's a known marketplace, and it really is the first year or 2 that you have to build that up within each one of these centers, and then after that, you pretty much know where those houses are, the housing availability is, and you know where the units are, and you know who to contact to help facilitate that transition. Is that fair
right?
to
So
say?
the capacity building component of each one of those pilot sites starts to diminish over time when we talk about housing, because you have established housing partnerships
Is
within
that also
community.
true with workplace? Because that was also a part of this initiative, was to also help find meaningful work for the inmates as they come out.
And that was one of the main components of the responsibilities of the community coordinator. And again, the community coordinator positions are still intact. And so they continue to work on that function of employment is a moving target. So they continue to work on that function.
Very good, very good. Okay, all right. You have one vacant position also in the misdemeanor probation. Is that
Misdemeanor probation? Yes, sir. And so that position was actually, and this is, again, a good example of use of technology. When the budget instructions came out, the director of misdemeanor probation realized that one of her vacant positions could be better utilized, or we could better utilize her existing staff and so her staff were going in the field to do audits at misdemeanor probation providers. And so a lot of those providers their audit results were very good or had very minimal findings. And instead of sending staff out to a location to do an audit, they started to do them through video conferencing. So that eliminated the need for one of those positions to go out in the field and do audits. So that is the one vacancy currently reflected in misdemeanor probation.
Are there any other vacancies in the misdemeanor probation?
No, sir.
Okay. Under the Governor's Office of Transition Support, which we were talking about just a minute ago, going out to the line item of 18.3.4, they were we talked about the operational efficiencies with that reentry initiative. That's part of, I'm assuming that's also part of what we were discussing before about eliminating those positions.
Yes, sir.
Okay. The freezing 7 vacant positions at line item 18.3.2 under the Governor's Office of Transition Support and Reentry. Those positions, how long have those positions been? How long have they been open?
Since the beginning of the year.
Okay. And then, in addition to that, so really just January 1st.
Yes.
Fiscal year.
Fiscal year. Okay, so July 1st.
Yes, it's a full 12 months.
Okay.
Recognizing the amended for those positions.
And how many more positions do you have vacant in that particular program?
We have one right now that we're advertising for. I've approved it to fill. And it vacated after the budget instructions were released and we had submitted our recommendations.
Okay. All right. All right. Any questions from any of the members?
I can figure out how to.
Chairman Powell.
Thank you, Mr. Chairman. And I'm not quite sure where to start on this because I do have a little bit of knowledge about y'all's agency. And I understand the process. God knows I've been here long enough. And I understand how agencies, when they're told by the executive department to start cutting. And I understand y'all have had to come up with a game plan. But I've got a few major concerns that I want to express.
Yes, sir.
And I don't know that this committee will actually make any changes or restore any funds or move things around, which we certainly have the ability to do. But in the criminal justice system that we have in Georgia, a few years ago we combined probation services and parole supervision. And those are a very vital part of our criminal justice system. Probation, of course, is the sentencing phases that judges give to keep these folks out of prison and occupying those higher-priced incarceration beds. Sometimes successful, a lot of times it hasn't been that successful because people that walk on the other side of the line sometimes have a hard time understanding for whatever the offense they were convicted and sentenced to. The other are the people that have already built time. They've had their postgraduate degrees in criminal activity. Some of them are just glad to be out and are willing to do things, but an awful lot of them aren't. And what we've done in y'all's agency, we've always had stationary buildings, locations for these people to show up for because of the nature of their personalities. And that's to put the pressure on them to be there, to show up, whether it be for drug testing or just so an officer can look them in the eye to see if they see anything. Now, I know that y'all do the best possible job that you can, and these cuts aren't at your own behest, because I've never known an agency that volunteered to cut anything. And y'all have come up with the best proposition, but I got a couple of concerns. One is what this is going to do to the traditional system of supervision, adult supervision. And I presume the documents that y'all have passed out are correct, that Georgia's the highest in the country. We've got 230,000 adults that are under some form of supervision.
Yes, sir.
And we've got, what, 1,500 field officers?
1,500 staff total, about 1,200 sworn.
1,200
Or
sworn?
1,500 sworn, you're right, yes, sir.
Yeah, 1,500 sworn. So we're expecting these 1,500 sworn officers to be able to handle this without a place. And it's not so much that they need a place to hang their hat, as much as it is a facility that the offenders can come to. Whether it's, and I heard the commissioner, when I first heard of this, I said, well, what are they going to do? They're going to track them to their house, make them pee in a bottle on the side of the road. Well, I hear y'all are doing a different way. You're going to the swabs and stuff like that. That's great. But still, you have some concern. I have some concerns that we're expecting these officers to be on the road and to work out of their cars with a computer or their homes. And I don't know what the situation is by every district. I know in the Northern Judicial Circuit, I think we've got 18 officers in the Northern Judicial Circuit. And my understanding is that we have 9 cars, basically, a car per 2. So how's this going to work? Are they going to be on 12-hour shifts that one runs the car here and the other runs the car the other time? And then the bigger problem that I see is that these offenders, by running a home-based delivery service, is how I look at that. How are we going to expect to keep discipline amongst those folks? And then to send out a sworn officer to go check on an offender at their home. Well, maybe that's going to work, maybe it ain't. But then again, that would, to me, is going to probably do more to put our sworn agents in harm's way, which is a major, major concern to me. Because if they think they're going to have problems, and they might call a deputy, or they may call another law enforcement agency agent to back them up, officer to back them up, I'm not quite sure that they're going to get that. And I've got major concerns about the hazard that's going to put our sworn officers into. And I mean, I certainly do appreciate the job y'all have done in the conversion. I think our system is certainly under the criminal justice reform of a few years ago, that it works a lot better than it did, because I was certainly, over the years, had been pushing for this idea, because parole and probation is basically the same thing, with the exception one is that where they've already come out of prison and need to be monitored, and the others were as an alternative to prison. So that being said, those were that's my comments on this. But I think that we are now fixing to move into an area that's going to be a recipe for disaster. And I'm certainly hoping that this committee might consider calling the question on this. You know, it's one thing to do away with travel to conventions. It's something to tone down on meetings or whatever it might be. But whenever we start creating a situation that has a potential of putting our most valuable resources, and those are state employees, in harm's way, then that gives me a great amount of heartburn. And that's, you know, what I just said is only my spin to it and how I see it. But at some point, we're going to be revisiting this situation. And I do appreciate the job y'all do. But I do have these concerns, and I would be remiss if I did not bring them out for this committee to hear that. The number one issue the number one best resources that this state has, and that's its loyal state employees, and even more so the folks that are in the public safety arena, whether it's in this area or in the corrections. But I also understand after almost 30 years that there ain't nothing sexy about putting money in a budget for the criminal justice system. There ain't nothing sexy about it. There ain't no votes there because the general feeling is, well, it's just a necessary problem that we got to deal with. But in the dealing with it, if we're going to move forward to stop recidivism and return these folks to productive society, then we've got to do the job that needs to be done.
I think that's well said, Chairman. I am concerned, I think we're all concerned, we are concerned, Chairman Nail has said that given the population, the number of cases that you have to work, we talk about cases, these are human beings that we want to be successful, that have paid their time to society, and they are now transitioning out. And the goal here is for them to be successful Georgians for the remainder of their life, and we want that to be the case. And that's where your department is so hugely important in trying to facilitate that. And that's why we were excited about the 14% reduction or increase reduction in the recidivism rate. We were seeing some market changes in that, and that was a programmatic change that was yielding a good return on investment. In addition to that, I'm concerned though, because Commissioner Nail said in his presentation to the full Appropriations Committee last week that we were maintaining probationary sentences for 6 years. And that there were diminishing returns as it pertained to that. And Commissioner Nail has provided studies to show that, which I'm going through. And so I'm equally concerned with what Chairman Powell is saying, but I want to know, and I want you to address the question of at what point are we better off to change state law in a manner that is both safe for the public, administers the final parts of justice as it pertains to these individuals, but also doesn't create an undue burden on our system and reduce the amount of contact and time that each officer is working with a particular case and a particular human being. Because I think what Chairman Powell is saying, part of what he's saying is that face contact, that contact that Commissioner Nail was saying was 10 minutes. For it to be productive, you need 30. And if we're increasing caseload, or we're dragging, or cases are extended for long periods of time, you're reducing the success that those probation officers can have, community supervision officers can have, trying to assist those individuals with their probationary period, making sure they're complying with the terms of the probation, and also working themselves back into society. So those are the concerns we're hearing. And then the statutes, the policy, the burden, they're at odds with each other, it appears to me. And so comment on this concept of diminishing returns over time. How would that affect and where would you recommend that we look at the statutes to try to roll back some of those probationary periods? And how would that impact your caseloads and the productivity in terms of the contact that your officers could have with the individuals that you're responsible for?
Yes, sir. Thank you. And there's a lot to kind of unpack there. First of all, I'd like to address the issue of some of the office closures and us closing offices and going to a model of supervising in the community. That model is not new. We have actually, since the 90s when we were given the authority to have our officers be sworn and carry weapons, supervision has been taking place in the field outside of offices. And the virtual office concept started pre-DCS. It started back with parole. And part of the issue was when we would travel around the state and go to offices, supervision takes place in the community. Supervision should take place at people's houses, at their jobs, at their counselors, at their treatment centers. That's where officers should be seeing those under supervision. What we used to do back and you'll hear Commissioner Nail refer to fortress probation, is you would have all those offenders, especially whether they were working or not, they would have to take a day off of work, they would report to an office, there'd be a lobby full of people, they would come back and see your officer for maybe a minute to 2 minutes. The officer would go through a series of about 5 or 6 questions about, are you still working in the same place, still live in the same place, have you used any drugs, have you had contact with law enforcement, see you next month. That's not supervision. Supervision takes place in the community. And so when we would go out and visit offices, what we realized is we'd walk into an office that may have 15 or 20 offices, and there's only 2 or 3 people there because the officers are out in the field where they should be doing their supervision. So we're paying for quite a bit of leased space around the state that we're not utilizing. And then in some instances, we were paying for spaces where we had officers that were working court. They may only have to be in court for 2 sessions during the month, for 2 days or 2 half days. And so those officers are occupying an office that we're paying a lease for the entire month and the entire year, when really the only time they need office space is 2 days out of the month. And so,
But I think we all understand rolling back a physical footprint. That's not the question that Chairman Powell and I are asking. We're talking about the workload and the contact. Let's go to that question.
so workload, criminal justice reform over the past several years has done quite a bit of work to start reducing the number of cases under supervision. So the number one driver of our officers being overworked over the years has been the fact that we lead the nation in number of people under supervision, that we have the longest sentences in the country. You're correct. And whether it's a straight sentence or a split sentence, it's either 5 years or 8 years. Those far outweigh any other state in the country. And so what we've had to do is look at how do we reduce those case numbers without asking for additional positions. There's a lot of research out there that talks about the amount of time you should spend with an offender to affect positive results. And that research will indicate that the things you need to spend time with them on are criminogenic needs. You know, do they have a substance abuse issue? Are you making a referral to those substance abuse classes? Do they have an employment need? Are you making a referral to employment? Are you creating capacity in the community for those things? And so what we have focused on is taking, for example, the court specialist positions. The time that an officer is spending doing functions that are not related to supervision, direct related to supervision, administrative functions, taking those functions away from them with positions such as the court specialist so that it frees those officers up the time necessary to spend that at a minimum 10 minutes with an offender to make sure that they're addressing their criminogenic needs. And so when you talk about, right now our caseloads are actually the lowest they've been since DCS was created.
Hold on, let's just stop right there. You've transitioned, we had 35 positions, and you had 47 we did last year to transition out of the courts and back in the field, right?
Yes, sir.
Okay, you have 1,500
Yes, sir.
sworn officers. That's a drop in the bucket.
So that is so, but right now our caseloads are lower than they've been since DCS was created. There has been a steady decline in our average caseload since DCS's inception. A lot of that had to do with the ability to move a lot of cases that were currently being actively supervised that were compliant, that fall in that bucket of people that were being supervised past 2 years that probably didn't need to be supervised anymore because they were compliant. The only reason we were spending time with them is because they had a fine or a fee that they had to continue to pay. And so we were supervising them actively under supervision because they had a fine or a fee. Well, criminal justice reform eliminated that. Those people can be moved to an admin caseload, and so we can focus on those that are the highest risk and highest need. So we've been able to target our supervision to those offenders that are the highest risk and highest need. And as we've done that, those administrative caseloads, they've grown, and the number of people that have been moved from active supervision to unsupervised, as well as criminal justice reform gave us the ability to request early termination of cases that were compliant if they met the criteria of being a nonviolent offender.
Right,
So
well,
there have been steps taken over the past several years to reduce the number of offenders that we need to spend our time seeing.
And how much time do the studies recommend that you spend with them to have a positive impact on?
A minimum of 10 minutes.
Minimum of 10 minutes?
Yes, sir.
Because I heard Commissioner Nail said that he was looking for it being more like 20 to 30 minutes is what he needs.
That's the optimum, yes, sir.
Okay, so if the commissioner is telling us that we're going to have optimal results, better results at 20 to 30 minutes as opposed to 10, or the 1 or 2 minutes that you just referred to, which frankly, it's not a big jump from 1 or 2 minutes to 10, then our question to you is what recommendations do you have to help get us to that goal? Because Commissioner Nail was suggesting in his opening comments was that looking at the length of these probationary sentences would be of assistance in that. If that's false, then I need to know that. If it's true, then we need to talk about that meaningfully and look at a solution, a legislative solution to address that point.
So and the point I was trying to make is that there have been steps that have taken place through criminal justice reform over the past several years to reduce the number of people under supervision. Ultimately, the best result would be to be able to cap those sentences at a 2-year mark. If you're in compliance, you have no violations, you're a nonviolent offender, you've been under supervision for 2 years, we know through research and some of those studies that you were sent that after 2 years you have a diminished return. If you get to the 2-year mark, the likelihood of you reoffending goes down significantly. So our focus should be on those people that are under supervision during the first 2 years. And either early terminating or capping sentences past 2 years would be a way to get us more time to be able to hit that 20-minute mark or that 30-minute mark with those offenders. And in some locations, we're doing that perfectly well. Other places, it's, you have windshield time, drive time, stuff like that affects how much time you can spend with an offender. And so part of our staffing allocation has been to reallocate positions based on need. So, for example, if Atlanta loses a position, traditionally we would take that position and put it right back in Atlanta. Now we're looking at where is the greatest need, and maybe that position goes somewhere else in the state because that's where they're having the most time spending the amount of time with the offenders that they need to. But to answer your question directly, the biggest issue that we have is the length of time under supervision. And any way that we can reduce that length of time under supervision gives us more time to spend with those higher risk offenders during the first couple of years when they're most likely to reoffend.
All right, so would you look at the code sections that you're administering and present those to me or my office or Courtney so that we can look at those code sections for the duration of probation? Take
Yes,
a look
sir.
at the codes. Okay.
I might add.
Go ahead. You're still lit up. I got you.
And I'm remiss to keep beating a dead horse on this, and I hear what you're saying. And all of this sounds good, but my experience in public safety, this is a labor intensive. This isn't like sitting behind the desk and typing on the laptop. This is labor intensive. And this idea and they've got drive time, they've got all this. Under the current operations, they've got a facility that these probationers, parolees are supposed to report to. Some of the officers go out and they check on them, but they go out and check on these folks when they don't come in. And since there's so much drug prevalence in a lot of these offenders, the time spent, 10 minutes, 20 minutes, sometimes that officer may need a little bit more time to find out where this offender is coming from, find out the influence of being at home. But now we're expecting these officers to go to their homes. And quite frankly, in the real world, it's one thing that whenever that offender knows they're supposed to be at that office or that brick and mortar location. And if they don't show up or if they miss several turns, then the officers may go to check on them. Or if they can't find them, that's when they issue an out of order to possibly revoke their status. And that's the stick they got. But if they don't have that access to do that, it seems to me like they're going to be spinning an awful lot of wheels. And then I go back to my concern about putting themselves in harm's way. They go to someone's last known address and there's a big to-do going on or whatever. Law enforcement officers will tell you right now that the most dangerous situation they're put into is domestic or a family violence or a domestic situation. So we're sending these folks spot on. First call is to go to their homes where they're going to probably encounter a domestic situation. And those are the concerns that I have.
And I certainly understand that, but the current model, even previous to these budget cuts, was that supervision took place in the field. The days of requiring offenders to report to an office have long since passed. We have not required offenders to have what we used to refer to as a report day in a long time. Report day would be once a month. They would all, and the other thing is when they come to their office, they know they're coming to the office. They know that they have to report on the first Tuesday of every month. So generally, they've cleaned up their behavior for that 2 or 3 minutes they're going to spend with the officer, and then they leave the officer and go on with whatever activity they typically took place in. So the requirement of offenders to report to an office we have not supervised in that capacity in a number of years. And so our officers have been going out in the field doing community supervision in the community since the inception of DCS.
Chairman Green.
Thank you, Mr. Chairman. Chairman Powell and I have been on this committee a long time, and we have learned over the years to go slow on the way that we implement a lot of programs and everything. And I have noted throughout Southwest Georgia that a lot of the facilities are given over to the department by the county with no rent, and that y'all end up paying a portion of their electricity and water maybe on that. So, Mr. Chairman, I think this just needs to be visited very carefully and slowly, and that we need to just get as much information as possible here.
Well, on that note, that would be helpful to get. I'd like for you to send over all the locations that you're considering closing down and removing the leases on. I want to know how much those leases are for each of the locations, with a specific location, the city, and how much that's going to be a savings to the department.
Yes, sir. And I will just address very quickly that we do have. We're not talking about closing every office in the state. There will still be a footprint of offices around the state that officers can go to when they need to. And the current locations that we have where there's 10, like we have 10 state-owned facilities, or in locations where we're not paying rent, those are not locations that we would be considering to close down. It's ones that are costing us lease agreements on a monthly or yearly basis.
Okay. Thank you very much.
Thank you.
Anything else, gentlemen? All right. Thank you so much for coming and taking all the questions. We had plenty of them for you. I hope that was engaging.
Yes, sir. Absolutely.
And we look forward to getting those responses today, if at all possible.
Yes, sir.
Okay.
Thank you.
Thank you. And gentlemen, sometimes if I Scott and Eddie, if I don't ask and you've got your light on, just wave at me, because sometimes I miss it on the screen. Commissioner Ward, we are happy to have your team here today. You can come up here if you want to, Scott. Yeah. I asked Eddie. Eddie said he was staying right there. He's got a. Oh. Come on up. Mr. Commissioner, thank you so much for being here from the Department of Corrections. I know that in my discussions with you and your presentation that you made to the full Appropriations Committee, I will commend you that our staff has been impressed with the thoroughness of a lot of the explanations, numbers, and cuts that you're proposing or recommending along with the governor's budget. That being said, I think what I want to spend most of my time on is about those cuts and how they're going to impact. Some agencies have come up and told us a lot about their agency, but we've been doing this for a long time, as Gerald has pointed out, some for a lot longer than others. So if we'll focus on those cuts in both the amended and the full budget, that will be helpful.
Yes, sir. And first of all, I just want to make a little opening statement. Again, thank you for having me this morning. And want to give you a little mindset about how I went about reducing this budget. My goal with our budget reduction submission was to improve the efficiency and effectiveness of the organization by leveraging technology and eliminating duplication of services through improved business processes to ensure our core mission was accomplished. And I think you're going to see that today. Today, we will review our amended FY20 Governor's budget recommendations. The following recommendations are in Section 19, which will begin on page 9 and run through page 11 of your tracking sheets. There are several line items in our recommendation. To help facilitate our conversation today, sir, we have divided the budget recommendation into 6 categories. One is the statewide changes, which are going to be the insurance, salary, and fringes, etc. Second, we're going to leverage the leveraging technology piece, utilizing technology to improve efficiency and reduce costs. Third, the business process improvements. This includes consolidating duties, eliminating duplication of services or processes, and eliminating non-essential items. Next is going to be the facility management, items related to specific facilities. And 5, revenue, increasing revenue from other sources to offset the state appropriations. And then finally, number 6, we're going to go over the governor's recommendation, items recommended by the governor. The first one is the statewide changes. This is an increase of $942,884 for DOS agency insurance premiums and spread across most programs. As you know, you've been here for a long time. I'm not going to read each one of those programs. Next, I would like to discuss the administration program budget. And that's starting with budget process improvements. And that's starting with tracking number 19.2.2. And that's reducing 3 IT contractor positions. 19.2.3, that's victim services. That's victim service team support. That victim service team supports pardons and paroles. The department is converting 1 manager position to a clerical position. The department will continue to support the program with just 2 clerical positions. What we had over there, sir, we had a manager in a clerical position, and we had a manager making about $117,000 a year just doing clerical functions. So we eliminated that position and just added another clerical position over there. In 19.24, the department is freezing 18 vacant administration program positions. These were either positions that were vacant for a period of time, or during our analysis, we determined that duties could be eliminated or absorbed by other team members.
Those, Mr. Commissioner, how many are remaining? How many are you holding?
Say that again, sir.
So you have vacant administrative positions. 18 is what we're freezing, and we're actually removing the money for that purpose. How many vacant positions do you still have remaining after the 18?
467 non-security. Those are non-security positions.
467 non-secured?
Yes, for the whole agency.
For the whole agency?
Yes, for the whole
Okay,
agency.
so that's not the Department of Administration?
No.
No, whole
Okay.
agency, okay.
Okay, all right. 19.25, we have assigned our mobile construction teams to facilities near our residents. The teams will continue to support local projects as well as GDC projects in their area. This will reduce travel expenses. This reduction reflects 1 position that was moved to state prison program. 19.26, we combined several staff training classes to reduce travel and course-related costs for supplies and materials. In 19.2.8, the department identified 4 education administrative positions that could be moved directly inside the facilities for its instructors. So we moved those from the central office level and put them behind the wire. 19.27, that's the governor's recommended an additional reduction in the travel budget. This is a total reduction for our admin program of $1,989,390 for the admin program. All right. Next, I would like to move to the detention center program. That's 19.3.2. Is for cost savings due to the consolidating of business office functions, resulting in amended FY20 saving about $28,250 in this program. This reduction affected 1 position, which was moved to a vacant position inside of the facility. Next, I would like to discuss our health program budget. That's 19.5.2 and 19.5.3. Last year, we rebid our mental and dental health contract. The new contract was effective July 1st, 2019, and included moving all existing GDC mental health counselors, dental health professionals, and related administrative staff to employment with the Centurion, who was the vendor. 19.5.2, by transferring the duties to the vendor, we were able to freeze 9 vacancies which will not impact healthcare delivery, and the amended FY20 cost savings for that was $353,329. On 19.53, $4,556,510 reflects the savings of transferring 95 positions to the mental and dental health contract provider. 19.54, $690,390 reflects a reduction due to relocating 11 mental health managers to security positions behind the wire. 19.5.5, this is a governor recommendation to reduce the EHR continuation funding. Due to increasing healthcare costs, the agency, we've hired a consultant to evaluate our healthcare delivery model, and the EHR solution is included in that evaluation. So after the evaluation, we'll know whether or not the model we're presently using, or do we need to go out and bid it out for another vendor. Now I would like to review the offender management budget. That's 19.6.2. The department has recently changed the criteria for placement in a county correctional institution to require GED or vocational certification prior to being placed in a county facility. This change in policy resulted in a savings of $1,325,000 by just changing that criteria by being placed in a county facility. And now what's happening with the county facility is now getting a better qualified individual that already has his GED and also already has his vocational training. Next, we have in the private prisons program, the governor is recommending an increase in the private prison operating funds. So you'll see that in that line item, and that's 19.7.1.
Commissioner, going back to 19.6.2, didn't we enhance the funding for the county correctional facilities last year or the year before that?
What we did, we gave them a per diem per day cost increase. I added $1 in my budget, then you gave me an additional $1. So that gave me the leverage to make that policy change and require an individual going to a county to have his GED vocational training so I could absorb that 1.3 back. So that was a quick change. And what it is, it gave me an opportunity to better change the culture a little bit inside the prison, because we said, okay, in order for you to go to a county camp, which is a more desirable placement in our system, we want you to get your GED, we want you to get your vocational training. So now guys realize, hey, if I want to go to a county camp, I got to get my GED or vocational training, so it's better serving us on the inside of the wire.
Okay, so the per diem is still effective, and that's still going to be paid out. The difference is that it's a higher threshold to get to a county camp.
Yes. Okay. And also, that will give, again, it will be a benefit to the counties, because they're going to get a better qualified individual that does not have to have will not take him away from getting his GED. He's job ready. He can go and work in the county and do the things he already need now, because he already have his vocational training and his GED.
I'm not sure whether they want the money or the people. So.
Well, it's helping me out. Next, I would like to review our state prison program. Did I skip it? Yeah, the state prison program.
Commissioner, I'm sorry. Chairman Green had a question about the health section. We'll
okay.
Thank you, Mr. Chairman. Commissioner, I appreciate everything that you do, and we've known each other a long time. Sort of give me a step-by-step under how your health centers are staffed. Is that through Augusta Medical College, each one of them?
GHC.
The facility?
Yeah, all of those positions are AU, GCHC, AU, which is our vendor who provide our health contract. So they work for those individuals. So they're responsible for the staffing for those positions.
So way down in South Georgia, in some of those facilities there, those are Augusta Medical College, what? Not doctors, but PAs? Or?
Yes, they work for that vendor, but they can live in that area. But they're a vendor of their employers. AU or GHC are their employers. And they are physicians and PA, physician assistants.
One of the biggest complaints, and I guess my name is on every wall in every prison, they write me constantly, is that medication is not given out on a timely basis or is non-existent from on that. Have you heard or?
Like anything, we get complaints about those different issues. But one of the things I always tell people, we're dealing with a non-compliant clientele. And we have processes in place where we have peer calls at a certain time. The individuals have to come for peer call. One of the things that we've done to make sure that those individuals are compliant, you'll see we added what's called a medical unit manager, who, because we had those issues of guys not coming to peer call, not being insulin abiding by taking the medication, so we added a position to each one of our facilities that's called a medical unit manager, who the main job is to make sure that those individuals are making their appointments and coming to peer call. And that's cut down on it sometimes, but you still, with an agency as large as we are, we're going to have some individuals that are non-compliant that are taking their medication.
What is that amount of the contract, if I might ask?
190 million. Total contract is $190 million.
$190
million.
Okay. Thank you, Mr. Chairman.
Mm-hmm.
Chairman Powell, I'm going to
Thank you.
follow back up on that.
Thank you, Mr. Chairman. Commissioner, good to see you here. And for the benefit of the committee, I always have a soft spot in my heart for corrections. Not because I ever anticipated it might be my final resting place one day. But, you know, I've watched the agency over the years. And again, I go back to my comments to the prior budget folks over here, that, you know, what we do in this state and the politics of it is that corrections has never been a sexy issue. It's not a vote-getting agency because of the clientele that y'all have to tend to. I am so proud that I have seen for the last, in recent history, the progression that corrections has made in basically changing how they do with the pressures that y'all have. And I do have some major concerns with that. I'm more happy to the fact that under your leadership and the previous commissioners, I have seen so many more positive changes in how the agency works and being forthcoming. But still, y'all have to deal with some of the worst of society. The problems that y'all deal with today with the clientele that's been sentenced, the gang violence, that is a whole new set of concerns that everybody in this state ought to have with what y'all have to deal with. But to echo or to feed off of a question from Representative Green, health care. We know we got to provide health care. Now, in this day and time where free citizens out there don't even have health care, they tend to wonder, well, why do we have to give inmates this? Well, quite frankly, it's because it is the federal law. And it's the humane thing to do, and they are a ward of the state, and we have to do these things. But I echo a little bit about the questions that Representative Greens have. Y'all have got a consultant that's looking at the medical care contracts today. I know that y'all still are contracted to Augusta Medical. And in the old days, that used to be considered, well, that's one state agency providing a service, and it all helps both agencies. But in this day of privatization, I'm looking forward to seeing what the consultants come up with. A lot of us who go back over the last 30 years that saw how basically any university agency, sometimes there's a little bit more padding and it goes into other things that might be in a straight line privatized contract with a vendor or a provider, might find that it could save us a tremendous amount of money by not piggybacking off of another state agency that's always looking for more funds and there's not questions to it. But I want to echo that and congratulate y'all on at least taking that step to start looking at that, because that's a major issue that we need to deal with.
Yeah, and I'm glad you said that, but I want to say something on behalf of Dr. Keel at AU. He has really come to the table in the last couple of months and sat down with our team and with his team to look at some strategic ways to reduce costs. But he also realized, he understands what we have to do as far as going out and looking at it to make sure that the model we presently have works. And he's open to that fact that we're out looking for that. But until then, he has agreed to work with me to look at strategies to try to reduce some of our costs. And we just met this past Friday in Augusta, sitting down and brainstorming on some ideas. And I just wanted to say that. Okay.
Yeah, thank you so much.
I think
one
that's-
further.
Go ahead.
Excuse me. One further question. Good example about this privatization. The Department of Corrections and the Parole Board entered into a venture a few years ago. God knows how many years it took us to finally get the attention to do it, and that was the privatization of a nursing home for the most infirmed inmates that were in the system. That was costing the department untold millions of dollars for health care to these older infirmed inmates. So now with this system that was worked out of a private provider building a secured nursing home so that they could be released by parole as a point of residency, that their care is now being covered for a big degree by Medicare, i.e. Medicaid if need be. And I understand that that's been maybe you could confirm, but I understand that's been a pretty tremendous success down at the old Bostic facility down at Milledgeville.
Yes, and they've done so well. They're in the process of trying to look to expand out. After I think we had a brief conversation last week, and since that conversation, I've had some more conversations, and we've reached out, my legal team, and we're are in the process of giving them our support about them wanting to expand out.
That facility has done so well, and I think they're getting pretty close to maxing out on their bed space, which they could probably make a little bit more room, but hopefully they're going to be adding on to that facility so that there'll be beds for these other infirmed inmates that we have, to give them a secure location and hopefully to take some of this burden off of the state's budget. So thank you so much, Commissioner.
Yes,
job well done with that.
Yeah, yes, sir. Next, I would like to review the state prison program as far as we talked about streamlining business processes. Tracking number 19.8.3 and tracking number 19.8.5, reduction of $6,114,458. That's a total of 185 positions. The department analyzed and re-engineered our administrative and business processes and identified consolidation of administrative duties. The department also evaluated the number of financial transactions processed at each facility's business office. Based on the analysis, the department is consolidating the processing of financial transactions within 3 regional business offices. The department is also consolidating administrative support positions throughout all departments within the facilities. All affected employees were offered mission-critical positions within the department, and of the 185 positions, only 23 chose not to take a position offered behind the wire in one of our mission-critical positions, and so we moved on from that. Next.
Let's go over these positions again. I want to make sure I understand what we're cutting here. In line 19.8.3, you're transferring auditing staff to vacant positions and then eliminating the human resource positions at facilities. How many was that?
That was 185 positions.
185?
Yeah, 185. And of those 185, and we offer every person a mission-critical position, because one thing I looked at when we first started looking at our reduction, I looked at every position that I said was critical mission focused. That was correction officers, food service, maintenance workers, teachers, chaplains, recreational directors, and counselors. We backed away from those positions. Everything else was on the table. And we looked at all our administrative positions, all of our clerical positions, and we were able to go out and do analysis, okay, how many did we really need at each facility, at any business office? And you know, over the years, through the advancements of technology and processing, we didn't need all those clerical helps. But what we did, we were able to offer those individuals a position, again, in those mission-focused positions. And a majority of those individuals who took those jobs, they got a slight pay increase.
So how many, out of the 185, how many actually transferred over and still with the department versus those positions that did not, those individuals who did not move over?
Give you a quick breakdown. 37 became correction officers, 18 became counselors, 9 became food service workers, 11 became store personnel, and we had about 12 that were at retirement age that went ahead and chose to retire, and then the others transferred to contractor positions. But of the 85, of 185, only 23 chose not to take a position because they didn't want a core frontline position.
Okay, so those 23 positions then are vacant and frozen and with no funding, is that right?
Yes, yes.
Okay, and then we also, at line 19.8.4, we were freezing non-security positions, and that was amounting to about 8.9 million, almost 9 million bucks. How many positions were frozen?
19.4, which one was that? Oh, the next page. Oh, that was the next page. You're ahead of me, sir. The department froze 193 non-security, non-critical vacancies and distributed workload to remaining positions, and we saved about $8,984,763. So those were non-security positions. Those were clerical type positions that we froze.
193?
Yes, 193.
And how many vacant non-security positions were left in the state prisons?
Is it 600?
Are you talking about the
Non-security, vacant non-security position, how many there is? Is that 667?
No, it's minus the 220.
Minus the 220, so it's 447.
That's for the whole department.
For the whole department, it's 447, that's the whole department.
Okay, so, yeah, so that was, you had said that a little bit ago. I just want to make sure I got it straight. So the total number of positions that are vacant, but funded in non-secure, how many of those vacant and funded non-secure positions are left in the whole department?
440.
440? 447?
Yeah, 447.
And then how many are secure, vacant but funded in the whole department?
Yes,
Secure.
so I got that number right here. Vacant security, is that 1753? 1,753.
Okay, and then that means that the number of positions that have been funded but now are eliminated because they're frozen, how many of those were secure positions?
None.
None. And then how many were non-secure?
I mean, all of those 220 were non-security, right? 220 was non-security.
220 total, this is for the...
Yes, yes.
Okay, so those
We
were...
didn't touch, security position was not touched,
Gotcha.
okay?
Very good, thank you.
Okay, all right. Next is 19.86 is consolidating training. We had a savings of $319,290 there. The department is moving more training online, reducing in-person classes. The department is closely evaluating options to reduce supply needs such as ammunition and supplies for certain law enforcement classes. Overall, this resulted in reduction in travel and vehicle operating expenses. One position will be reduced to a lower level training position. And 19.8, reducing part-time staff. There's going to be a savings of $2,652,394. The department is reviewing all part-time positions to further reduce personal services expenses.
All right, Mr. Commissioner, how many of those how many staff positions were eliminated?
We don't have the number for the part-time. We can get you the number for the part-time positions.
Okay, and then the follow-up question will be, how many is remaining that is funded, but you're not freezing?
For the part-time.
For part-time.
For the
yes.
part-time.
We'll get that number too.
Okay.
And then while we're talking about this, I mean, these are large numbers that you have vacant and funded, even residual positions. Two questions. One, why are they not filled, those positions? And how long have they been vacant?
Well, that's most of those are correction officer jobs, and that's constant turnover, constant turn in those positions. At any given time, sir, we have about five.
Okay. Go ahead.
Any given time, we have 5 job fairs throughout the state. We're constantly, our HR team is on military bases. Anywhere if we read about a plant closing somewhere, we're going to have a team there meeting with that HR personnel, trying to get people on board and get people hired. So that's mostly coming from our security positions.
So the 1,700 secure positions, you're trying to fill those positions. How long have they been vacant?
We average.
Kind of like on an average basis.
Average base, because I know some of them may be vacant yesterday, Some of them may have been vacant a year, but, or longer, but,
On average, our CO vacancy is running about 40%. That's on average. But we do have a good sign of hope. Last month, we had a net gain of 56 correction officers.
good.
For the month of December, was it December? Month of December, we had a net gain. And I tell people this, I think I said it in my joint meeting, I've been on the job a little bit over a year. I had a 14-month time limit for myself to start turning this big ship around a little bit. So I got a net gain of 56, and I'm gonna keep on rocking.
That's good. What about the non-secure that are funded, the 447? How long have those positions been open?
That, we need to run the number and get you
Okay.
the average.
Yeah.
Because I don't want to take a number that's not correct.
Okay.
There's constant turnover in admin positions, people get promotions or leave, so.
And also, you got to realize, once we got to initiative to start with this reduction, we purposely held off filling positions as far back as August. We just started just holding off filling positions.
Okay, all right.
Okay. Next is the is 18.8, I mean 19.8.9, 19.8.10, and 19.8.12 in its education. And that's a saving of $1,321,114. The department is converting 26 teaching positions to instructors. The department identified 7 education administrative positions that could be moved to direct instruction in the facilities. And due to a funding model change, the Charter High School program is now partially funded through a formula grant. This reduction aligns funding with actual expenditures. So again, that was a saving of $1,321,114. Next is 19.8.11, telecommunication costs. That's a savings of $2,030,354. The department has initiated a thorough audit of all technology expenditures to include GTX expenses, computer hardware, and software. The department has also reduced the number of phones and other wireless devices by employees. 19.8.13, assigning mobile construction to facilities. This is the state prison program portion of the conversion of the mobile construction staff being assigned to facilities near their residents. These teams will be focused on projects in their area, reducing travel and vehicle maintenance and operating expenses. This will result in 45 positions being moved into the facility, meaning what we did, those mobile construction officers, we just assigned them to a facility near their home, so they didn't have to per diem or staying over the night in hotels and things like that. So they're still on their positions, but just assigned to a facility and going out and do their job. Just they come to a facility in the morning, park the vehicle, get the inmates, and go to work. 19.8.4, reduce travel through utilization of online training, consolidating training courses, and foregoing conferences. We had a total saving of $2,111,326. Next, I would like to discuss how we are leveraging technology to reduce expenses. 19.8.2, timekeeping system. Our current system does not provide real-time management information for managers and supervisors to monitor hours worked. In FY19, we spent over $26 million in FLSA overtime expenses. The department piloted Kronos in one location that resulted in over 50% drop in FLS overtime expenses. And Representative Green, you liked it. That was down at Calhoun State Prison with Warden Tamar Smith. And he had when we put the Kronos system down there, he had a 50% drop in FLSA overtime. The department has started the transition to Kronos and will be complete by early FY21. Total projected amended FY20 savings of just going to that timekeeping software would be $6,549,000, $6,549,802. And with the Kronos system, it gives the warden real-time management system, meaning that with our old timekeeping system, it would be 3 pay periods before we know if a guy had worked over or not. But with the Kronos system, he can tell whether or not an individual is getting close to 171 hours. Anything over 171 hours in a pay cycle, we have to pay overtime and have overtime. A warden can see which officer is getting close to that. If he needs somebody to work over, he can get somebody that has less time to come in and fill that spot versus putting someone there who's close to going over to overtime and can better manage that overtime at his facility.
That's good.
Next, 19.8.7 virtual courts. GDC currently transport offenders to and from court for more than 17,544 hearings per year, which equals about 35,088 round-trip miles. Video conferencing for these hearings, as well as many more cases, provide savings and other benefits. The projected savings of $1.2 million is for amended FY20. We see significant savings in staff time and productivity, reduces the need for security coverage for court hearings, decreased risk of transporting inmates to court, improves safety for staff and court visitors, and fuel and vehicle maintenance savings. Our goal is to have 50% of all circuits on board by June the 30th, 2020. Right now, we have 8 of the 49 judicial circuits on board, and it's really been a really big hit as far as not transporting those guys back and forth for a 5-minute hearing.
That's very impressive.
Yes. Next is revenue increases to other funds offsetting state appropriations. 19.8.15 work details. That's the amended FY savings is $1,106,000. The current reimbursement rate does not cover current costs. This increase will cover the cost of our COs on details. We're just asking the county to pay for the cost of the officer who's watching that detail. Next is 19.8.16, that's the commissary. Amended FY20 savings, we're projecting $1,482,897 on average. By increasing the price on items in the commissary for FY20 by 2 cents, we would garnish that savings, garnish that profit. Average pricing is a minimum of 40% less than retail pricing. We're still 40 cents below what they pay on the street for items we sell in our commissary in the inmate store. So we're increasing each item anywhere between 2 cents to a nickel, but on average it's only a 2 cent increase for the items that they buy in the store. Next is 19.8.17. The governor is also recommending additional reduction in the amount of $45,809 to meet anticipated expenditures. Next, I would like to discuss the Transition Center program budget. 19.9.2, the Albany TC was closed. The facility was in significant disrepair, roof leaks, mold, and structure issues. The landlord would not make necessary repairs, and this caused a health, life safety issue for staff and offenders. 38 staff transferred to other positions in the area. 150 inmates, residents were transferred to other facilities. In amended FY20, we will have a savings of $1,562,175. But I also want to point out that we're bringing 100 beds, 100 transition center beds online at the Claxton TC, Smith TC in Claxton, and also up the road at the Metro Entry facility. We're going to add 240 transition center beds. So we have a net gain of 190 more transition center beds, even with the closing of the Albany Transitional Center. 19.9.3, the department is freezing one vacant non-security administration.
Hold on, Gerald has a question for you.
Okay.
Thank you, Mr. Chairman. The Claxton transition, when is it supposed to come online?
We're going to fall of next year.
Fall of next year.
Yes. You know,
And that's 100
additional beds.
Okay.
Right there for that. And also you all gave us bond money last year to expand, to do the 3rd phase of the Metro Reentry facility on Constitution Avenue here in Atlanta, and we're going to add a 240 bed transition center to that facility over there also. And that's why I said the net gain of 190 beds.
Mr. Chairman, one other.
Sure.
So, what in the scheme of things and the numbers, how many more transitional beds could do we really need?
That's a loaded question, Representative.
Yes, it is.
Very.
Because I've got an idea.
There's always a need for a transition center bed. I'm going to leave it at that.
What's that?
There's always a need for a transition center bed. If you want a way to impact an individual not recidivating and coming back to prison, you know, you give them a transition center placement, being able to go on the street with somewhere between $12,000 and $15,000 in his pocket, is likelihood of him being able to put a deposit on an apartment, get him a little leeway to find another job. That's the key. And we have a lot of success stories to our transition centers.
And-
Right.
Go ahead.
Thank you, Mr. Chairman. This is one of the best incentives I've ever seen, and I have followed many of those individuals that we were able to get into a transitional center, and then as they come out, we have watched them become very productive citizens. So I'm a great believer in those transitional centers, and that's the reason for my questions there.
Well, following up on that, Mr. Chairman, is that not only the question is, how beneficial the beds are, there's an occupancy question. Where else would we have beds to place them? Because we're building Claxton, right? Okay, and you're expanding Atlanta. So where else, what other facilities would we have to add additional beds? Should the committee see that it's important to continue in that direction?
I will direct somebody towards you, because I had that question asked me even yesterday about a community who wanted a transitional center. So I will direct them to you.
Just looking down the table here.
Yeah.
We'd love Albany.
But again, I will echo that a transition center bed is a great return on investment.
And the transitional facilities, where are they located? We have Claxton facility, that's Albany.
We have them strategically placed. We have them in Augusta, Savannah, Claxton, Alma, Valdosta, here in Atlanta. We have 3 here in the metro Atlanta area. Augusta, and I think that's everywhere. And Arendelle, Phillips and Arendelle.
Okay. All right, thank you.
In Macon, too. We have one in Macon.
Thank you.
Okay. Next, we 19.9.3. I'll talk about departments freezing 1 vacant non-security administration position. Most of these duties were moved to the regional business office. 19.94. This was a GED fast track program funded in FY 2016. Now the GDC has well established GED training programs and testing throughout in our facilities. This fast track training is no longer needed. This resulted in a savings of $275,000. Okay. And with that, sir, that concludes my presentation. Subject to further questions.
Just a comment. Could we get you to teach a class to some of these other agencies how to cut a budget without no, seriously, and this is why I'm one of your biggest fans. It's interesting, as you know, I've been through many facilities with you, and it's amazing the respect and honor you have everywhere from the inmate to your deputy chiefs, and that's hard to accomplish. And again, you've always looked at cuts who would benefit the offender so that they don't come back. So I just appreciate that and everything you've done.
Well, thank you, sir. You made my day with that comment.
Additional questions? Ms. Clark?
Yes, sir. Thank you, Mr. Chairman. Mr. Commissioner, in the past, we have provided some funds for a multi-year project to move all health record of prisoners to an electronic system, and last year the project was being renegotiated. Where are we at with this project now?
We took a strategic situational pause because we've hired this a consultant to look at our healthcare model, and we want to see whether or not, if we do a new healthcare model, that's going to be bundling the EHR records also. So that's why we took a situational time out with that.
So it's still in negotiation?
Yes.
Okay. Thank you.
Thank you, Mr. Clark. Also wanted to follow up a couple of things. Now, the cuts that we're talking about to the non-secure and to the, well, none to the secure, but to the non-secure, the 220, how is that going to affect operations for the Department of Corrections?
Again, we sat out as a team. We looked at everything that were core mission positions, and we didn't touch them. Everything that we touched we did it in a way that would bolster what we do behind the wire. So I think we've done an awesome job of doing that. And the vacancies that we turned in, if you think about it, a lot of those was those clerical positions over the years. We used to be a paper-driven agency. Through technologies and changing the processes, we just did a staffing analysis, and we really didn't need a lot of those positions.
In the occurrences of the hurricanes that have hit southwest and southeast Georgia, we had talked with previous Commissioner Dozier about transitioning a lot of those records into electronic files.
Mm-hmm.
Where does that stand in the process? Because that goes to the point you're making about it being a paper-intensive agency. If you can eliminate those papers, then you're also, in a way, not needing the positions to manage and maintain them, or the facilities.
Mm-hmm.
How is that going, and where do we stand with that?
Well, again, we like I said earlier, we just took a situational pause with that when we went out with medical consultant, trying to bundle all of that together. If we find a better model that of healthcare delivery, whoever the vendor might, if we go out and get another vendor, they would come with a medical health care record.
Oh, I'm talking about beyond just your health records.
Mm-hmm.
Other inmate records, the entire file that goes along with the inmate to track their performance and what programs they're taking, and that is ultimately sent over to probations or to the.
And that's in Scribe base. We already have that in Scribe base. They can have access. DCS has access to our Scribe to be able to look at program completion and things of that nature. They can look at that already.
So that's all digital now?
Yes, most of it, yes, in Scribe.
Okay. Good.
And then, again, I visited, I was at Ware State Prison on yesterday, and making my rounds, went through the medical clerk's office. She would meet me at the door. I thought we were getting the electronic health record. I said, it's coming, hold on. So they're screaming for it out there also.
Very good.
Okay.
Commissioner, thank you very much. Thank you for your staff and time for being here. Appreciate the hard work. We have a question, sorry. Representative Holcomb.
Thank you, Mr. Chairman. I have a couple. The first is, with respect to the training opportunities for those who are incarcerated, whether it be on-the-job training, vocational training, or pursuing their GED or high school degree, can you tell us a little bit more about the impacts of these cuts across the system in terms of what's going to be available to the prisoners?
We cut no programs, anything. Those, like I said, any job or program that were a part of the core mission that touched an offender, we did not touch. I still have my same goal as far as 3,000 GEDs for this year. Same goes, almost 48,000 participation in programming and vocational training. Jay Sanders is standing back there, my assistant commissioner for inmate services. He's gotten that charge. So we didn't touch any programming during this budget cuts. That's what we're so proud of.
Okay, great.
Okay.
One last question, though. I need to follow up with you on the construction work details. I know that, tell us about those work details relative to providing assistance to counties, local governments. They are traditionally, they have called upon the local prisons to provide services in that regard. Where does that stand, and will it continue?
It's still in place. Like I said, only thing we have two things. You have what's called a regular work detail that's assigned out of each facility, and then what we have is mobile construction, which is more of our highly skilled laborers that build your courthouses, your state patrol barracks, your senior citizen centers, your baseball parks, and things like that. What we did with the mobile construction, we just regionalized it. In the past, we would get a detail assignment. We would give a detail officer assignment. Maybe he live in South Georgia. We had a project up in North Georgia. He will leave out on a Sunday, go stay in a hotel room up until Sunday into Thursday. We can pay him pay the hotel room, pay the per diem. What we did now, we just regionalized it, meaning that those individuals wouldn't have to travel. They would be located at their residency, working projects in their area, and so we could still maintain those functions that we've been giving to the community by building those things. So we haven't cut anything out. And locally, you saw we just increased the cost per the officer to make sure we can offset his salary to ensure that we still gave the services to the local community by those work contract details.
Okay. All right. Okay, Scott, go ahead.
My other question is on I have two. The first is on 19.7.1, the private prison increases for both the amended and for next year. Can you give us some more clarity as to specifically what that's for? Is it just for salaries, or is it for something else?
It's for salaries.
Only?
It's for their salaries. I
Okay.
think I think it was last year before last, they gave a salary increase for both our private vendors. It was a calculation issue with one of our vendors, and that's just to come back and get some conformity as far as the calculation of both the salaries to the other private vendor.
Okay.
Okay.
And then my last question is, there are a number of initiatives that could lead to higher rates of incarceration, whether it be the efforts that we've taken to test the backlog of sexual assault kits, and now we're bringing cases to prosecute those, efforts towards addressing gang violence, et cetera. Any issues or concerns in terms of the potential for maybe a greater demand on your services in the short or long term?
Well, I think in my speech to the Joint House, we're projecting in the next 5 years about a 1,500 increase in our population. But we have a great working relationship with the Pardons and Parole Board. This morning, we just met with them, a population meeting, because we look at our population, the growth, we look at our leases, and in collaboration with them, we look at services that we could offer to our offenders, such as vocational training, GED, what kind of cognitive group we can give those individuals. So when it's time for further release and parole, they're eligible candidate to get out. So we can kind of absorb whatever initiative that's going on, we can kind of dictate our population to absorb the incoming population, if that makes sense.
It does. Thanks.
Okay.
One more question, Representative Clark.
Thank you,
Chairman
Mr.
Clark.
Chairman. To go back to the private prisons again, what is the cost to the state for an inmate in a private prison versus a state prison? Is there a cost savings to this, or is it
About around $40 a day
for a private prison?
for private.
And what is it for a state prison?
We're in the 60s, but
When we did this before, that study was done, but we learned in that study process that the cost per day, so I'm not sure if your numbers are going to reflect that, but the cost per day did not include the capital cost.
capital costs and things of that nature.
Yeah, so-
And fringes.
So, all the fringes, all the benefits, it wasn't an apples to apples
Yeah.
comparison. We brought the Department of Audits in here a couple of years ago, and we went through that with them, and what we found out was they weren't doing an apples to apples comparison. It was an apples and orange comparison. They weren't considering capital cost, upfront cost, the fringe benefits that all went with it, so you didn't get a true number. You may have that, but they didn't have it.
We don't have it for the privates.
Okay.
Yeah.
Okay. And you said it was in the 60s per day for a state prison?
Yeah. We can give you our number per day we can see the cost for our inmate.
Okay.
Okay.
Yeah,
Thank you.
Yeah, that's a good question. It's just that we don't have the answer to it.
Yeah.
Thank you very much.
Okay. Thank y'all.
All right, Department of Juvenile Justice, we are welcome to have Commissioner Tyrone Oliver and his staff. I'm sorry. I skipped over GBI. That has no bearing on me trying to get out of here any faster. I intend to spend as much time as we need on each one of these agencies, so. Depending on how long it goes with GBI, I'm going to shoot for a little break around 3 o'clock, just depending on how long this goes, but right around there when GBI is finished, we are going to take a good 10-minute break for the committee. Some members have to go off to another meeting and hopefully we'll be back in time, so we're going to allow for that as well. So look around 3 o'clock, we'll be shooting for that break. Yes? You do? Well, tell them to pave some roads in Henry County. So Director Vic Reynolds, we are so happy to have you.
Thank you, Mr. Chair.
And I was telling someone earlier, I was telling Scott actually, I was telling him earlier that I very much appreciated your presentation to the full committee. I appreciated the thoughtfulness and the candor that you expressed to the committee, especially and Representative Holcomb has left, so I'll probably have some questions regarding the rape kits again, the status of those. You were prepared, you had the answers. We'll go over them again just to make sure we're
Yes, sir.
connecting on those levels, but I wanted to express my appreciation to you in that presentation.
Thank you. Thank you, Mr. Chairman, and gentlemen, I appreciate the opportunity to be with you today. I'll make a very brief statement, then we'll march right into the budget. Let me just take a moment to thank each of you and thank this committee for your continued support of this great agency. I'm very honored, very humbled to serve as a director, and on behalf of the dedicated men and women of the GBI, thank you for your continued support over the years of this agency. We're here today to support the governor's recommended budget concerning our agency. Most of you may know this is my first budget process at the state level. I've been through several with county commissions, but this is my first one here. I was appointed after these processes occurred last year, so thank you for this opportunity to be here. As I said a moment ago, I'm extremely proud of the work that this Bureau does day in and day out. I'll speak very briefly on it before I march into the budget. We have three separate primary divisions of the GBI. Our investigative division does great work under the direction of Deputy Director Dutton. I'm so proud of the work they've done in combating criminal street gangs in this state, combating the scourge of human trafficking, major narcotics trafficking, exploitation of our children, and various other crimes that they investigate day in and day out. And we will commit to you that we will continue to fight this battle. I'm also very proud of the work that GCIC does, our Criminal Justice Information System division of the GBI. They're available 24 hours a day, 7 days a week, 365 days a year, providing information to law enforcement to keep them safe at 2 o'clock in the afternoon or 2 o'clock in the morning, so I'm extremely proud of what they do. I'm also very proud of the forensic section of our Bureau led by Deputy Director Cleveland Miles, our new Crime Lab Director, who is here with me today. I'm proud of the work that they do every day. The reputation that they have around this state is beyond reproach. As a former district attorney, I know how important they are in every case with forensic work done, and I thank them for what they do. As I told the full committee last week, my vision for the GBI is for it to be the best investigative agency in the United States. Not one of the best, not the second best, but I agree. So if we're not, we're real close. And that's thanks to tremendous leadership previously by Director Keenan and the men and women primarily who do this job day in and day out. But I will submit to you that I believe in order to become the best agency and to continue to be that best agency, we're going to have to do things just a little bit differently, particularly as it concerns our forensic section, the crime lab. My eventual goal is to free up the men and women of that lab to allow them the time and the resources to do the cutting-edge scientific work they're capable of doing to seek justice in a case. Contrary to what a lot of people may believe, and a lot of my prosecutor friends, the function of the crime lab is not to assist a prosecutor, it's not to assist the defense, it's to find the truth. And that's what they do day in and day out. So we want to make sure they have every ability to do that. As I explained to you last week in full committee, we currently have 44,000 cases in our crime lab. We have 6 labs around this state. About 50%, close to 50% of those cases are less than 12 months old. About 70% are less than 24 months old. The remaining 30% are my immediate concern as we do a deep dive into the lab. I submit to you that we have to look at those cases. We have to work with our prosecution partners to see if we need to even keep or have those cases. And I am relatively confident that once we begin that process with our prosecution colleagues, we're going to find that a number of those cases don't even need to be in the lab. We intend on cutting into those cases soon and driving those backlog numbers down.
And that's because you're receiving, every prosecutor and wants the best evidence, and they want to have the TV projects this image that CSI gives you all the data and all the scientists, and we ferret out all those that are criminals or guilty because of the science and technology that can be employed. And then likewise, you have defense counsels that also want to be able to combat that in a sense and challenge that evidence. But the truth of the matter is that a lot of the work that's done in terms of prosecuting crimes is still good old police work.
Yes, sir.
It's witnesses and it's testimony and it's the direct evidence that you find around a crime scene that's used, and sometimes the science is just to confirm what we intuitively already know, or what we actually know from direct evidence and witness testimony. So you've got to have a percentage. I don't know how significant it is, but it would seem a significant percentage of what comes in are crimes that, frankly, prosecutors are just looking for that extra bit of evidence, that extra bit of confirmation, but isn't necessary to proving the case. And so what I'm hearing you say is you're going to kind of go through that process with prosecuting attorneys counsel, start to learn how to select those cases which need that scientific reinforced evidence, as opposed to those cases which do not.
That's absolutely correct. In fact, I had an occasion to spend some time with my district attorney colleagues, a great fraternity of which I was a member for a number of years, and I shared with them recently that the reality is the crime lab cannot be a buffet line where you go through and say, this is what I'd like to have, that's what I'd like to have. We've got to be able to realize what is needed to prove a case or to seek justice in the case, and that's what we're going to go on a mission to do, to make sure we work with our prosecution friends to do that. But again, I think we have to do a little bit more than that as well. We have to look seriously at the potential of outsourcing cases. The backlog we have, the cases we have, the 44,000 that we have in the 6 labs, 77% of those cases fit in 2 separate sections, 2 separate disciplines. One is chemistry, that's drug identification. How do you identify, what is this? Is it cocaine? Is it methamphetamine? Is it heroin? The second section, which is a rule, is run at about 50% of that, but it's jumped up in numbers, and I'll tell you why in a moment, is our forensic biology. That's DNA or serology cases. And I believe, in speaking to our folks and looking at numbers, that those 2 areas are ripe for outsourcing. I believe we can outsource in those. In fact, we have been gracious, or been fortunate enough to receive a Coverdell grant to help us with some drug identification cases. We anticipate somewhere around 1,900 to 2,000 of those cases being sent out for the purposes of identifying those with our private lab partners that we've contracted with. In fact, yesterday when I was speaking to the private lab, they told me they're getting to a point where they would literally be able to take 1,000 cases a month in drug identifications. We're not going to do that yet. That's mighty ambitious, but we do have plans of sending out cases to them for the purposes of identifying them. We also have been fortunate enough to have received a DNA backlog reduction grant of over $1 million. That will end up probably testing somewhere in the neighborhood of 1,400 to 1,500 DNA cases that we anticipate sending out. So we want to see how that outsourcing works, work with our prosecution partners again to make sure that that is going to work, and if it is, we need to look for funding sources through grants for outsourcing. But we need to do more than that. We need to examine the operations inside the Bureau as well. We need to identify the potential bottlenecks within our lab, within our processes. We need to evaluate staffing allocations. We need to evaluate the eventual impact of potential changes to our processes. And even more than that, we need to look at the way we train our scientists, and we're doing that. For years, what we have done is we basically take a scientist and said, steps 1 through 5, you have to know before we're going to let you at the GBI test anything or do anything as a scientist. So what we've started doing is maybe training steps 1 and 2 and saying, go do 1 and 2. And then we'll train you on 3, and then go do 3 and 4 and 5 until they ultimately become that scientist. So that's some of the things that we're beginning to do there as well. And I'm convinced that we're at a point in the lab where we're going to have to commit ourselves to doing something different than simply coming over here year after year saying, give us more folks.
How long
will we take them? Absolutely.
How long would it take to do that analysis of figuring out your efficiencies within the scientific protocols that you have, and also educating the DAs and to do that sort of triage of really what cases need to come, and then also to establish the contracts with the outsourcing labs that you may be considering, given that you have to establish a level of protocol that matches yours, and that you also have to establish chain of custody so that that evidence can be presented in court?
We have existing contractual relationships now with labs that we're comfortable with that can do that. The other items, as I told you, told the full committee last week, my commitment internally at the GBI is focus number one on this crime lab. So this is what I'm going to be doing this year. Obviously, I have other responsibilities. We're going to be pushing forward on gang work, on human trafficking work, but this is inside of the GBI, particularly at headquarters. This is job function number one. I'm confident in telling you by sometime, probably certainly during this calendar year, maybe by sometime summer months, I'll be able to look at anyone on the committee saying, this is where we're at, this is what we can do to make this better, and this is what's working.
Okay.
So I feel confident about that.
Then also, and then the conflict we have is that GBI had written a white paper to us in 2016 telling us that they needed 81 additional forensic scientists to meet current and future demands. In 17, we were able to put in 18 scientists, and 18, we were, fiscal year 18, put in 10 more plus 2 lab techs. We added a couple more in 19 and 20 for about 6 or 7 more, I think, total of those 2 years. So looking back at the reports we received, 81, we have basically effectively gotten to about a third of that in terms of that statement. It's a significant, if that was the demand and that demand hasn't tapered off, that's a significant differential to overcome with protocols, outsourcing, which you already have, but more outsourcing, and also just addressing the internal nature of how the triage of cases that come in from PAC. So to me, it sounds not insurmountable, but it does sound very significant, and I'm glad you're going to spend the time to focus on it to see how much you can cut into that. But that from our standpoint, that is the differential, the delta that we're having a hard time overcoming when we're talking about cutting science positions that we've already funded.
Yes, sir. Well, you know, I guess in reality, Mr. Chairman, and I'll speak in the spirit of being as candid as I can, because I know you're always that way with me when we talk. The reality is, in hindsight, if we had been, if some miracle would have occurred from a budgetary point of view and 81 scientists had been granted to the lab when they were requested, I doubt seriously I would be standing here telling you that we had at least the level of backlog we had. I couldn't look at you and tell you we wouldn't still have one. But I am convinced of this. I'm convinced that asking for bodies alone, standing alone, will not solve this backlog issue. It just won't. I wish I could tell you that it was, because that'd be a lot easier on me, but I don't think that's going to happen.
I think it's going to require all the things that you've listed, but I'm still suspect on the loss of bodies.
Yes, sir. I understand. Just to sum up these comments, and I'll move into the budget, I do believe it's a time for us to really take stock of ourselves, to look at a new approach, to think outside the box, to be willing to tackle the issue by getting rid of those cases we talked about, by deciding what shouldn't be in the lab, by looking at outsourcing seriously, looking at our operations and adjusting our training program, and I will stand here and tell you that we are ready to do that in the lab. Again, thank you for what you've done for us. Thank you for your time, and I'll move directly into the budget. I think we're number 30 as far as numbering system is concerned, and I'll begin at this top and work my way down and answer any questions that I can as they're posed. Beginning with 30.1.1, that's just an addition to the budget of about $28,000 because of adjustments made for self-insurance programs, so DOAS. But moving into the heart of the matter, the first section is administration at .1.2. And there'll be, first of all, a reduction of funds by decreasing traveling costs. We're taking some money out of the budget for the purposes of traveling. I think that's about a 16% reduction in the travel costs for our administrative section of the Bureau. And in .1.3, we'll be reducing funds by freezing 2 vacant positions which exist in administration. That's a savings of about $144,000. Moving down into the Criminal Justice Information Services, CJIS, or what we refer to as GCIC, at .1.2, we're replacing state funds with other existing funds. And let me tell you what I mean by that, because I think it takes a little bit of explanation. One of the things, Mr. Chairman and members, that I committed to do as the director is take a long look at some things that we were doing at the GBI that were outside the scope of the mission of the Bureau. For example, we were doing what's called a disposition recovery project, where we would send our people from the GBI to various Superior Court clerk's offices, particularly in the metropolitan area, and task them with assisting that clerk's office to work through a backlog of their cases to report to GCIC. We would send our folks to go do that, and it was called a disposition recovery project. We're not going to do that anymore. I don't mean it disrespectful to my friends in the clerk's office, but that's not what the GBI needs to be doing, and so we're not going to be doing that anymore. We also were involved over the years in a mission with the Sexual Offender Review Board. The board previously had a task, it's my understanding, of doing the background investigations on individual sexual offenders who were asking to be placed at certain levels or determining what level they fit. Eventually that task was turned over to the GBI. As I began looking at our operations, I was of the distinct opinion that we should not be doing that. I met with the director of SORB. She agreed, she wanted those functions back, so we intend on hopefully giving that back to her along with those individuals. And together that will eliminate some positions as well, and through CGIS we'll also be eliminating 5 positions, including 3 training positions, a programmer and a project manager, and that will all be to the tune of a little over $1 million back to the state budget. And point 2.3, the last item under CGIS, that's reducing funds by freezing 2 vacant positions. That's a CGIS compliance specialist and a CGIS analyst. By losing or freezing the compliance specialist, that will reduce us from 8 to 7 individuals in that particular section, and the analyst position will reduce us from 11 to 10 positions in that particular area. We still believe we can accomplish the work. That's a savings to the tune of $130,000. Moving down into the more difficult circumstances, obviously the forensic science services under point 3.2 is a reduction of funds to the tune of about $705,000. That includes the elimination of 3 current vacant scientist positions. They're spread out among 3 disciplines, Mr. Chairman. One is toxicology, one is firearm, and one is impressions and latent prints, along with reducing funds by eliminating 2 vacant lab tech positions. One of those is in chemistry, and one is up at our Cleveland, Georgia lab. And by capturing some delays in hiring in some promotional positions, an assistant manager in chemistry and a technical leader in forensic biology, and that will all come to the tune of some $705,000 savings back to the budget. The other item there's no more items under that particular section. It moves directly into our investigative division then. That's items point 4.2. That's a reduction of funds to the tune of about $1.6 million, and that's by eliminating vacant positions there, both sworn and non-sworn positions. The sworn positions are just what they say they are. They're agents of the GBI that are vacant at this time period. The 4 non-sworn positions include a programmer, a forensic financial auditor, and the 2 SORB intel analysts that I talked about a moment ago. We anticipate in fiscal year 21 those positions going back anyway to SORB, and we'll be losing those positions. We will obviously have some delay in hiring for other appropriated positions, and all of that will be to the tune of the $1.6 million. Point 4.3 is the one-time fund for the development of a gang database. Again, without speaking too much out of turn, I anticipate that database being up and operational. I will tell you that has been an unbelievable joint effort. I don't know if Commissioner Nell is still here or Commissioner Ward, but DOC and DCS have worked hand in hand with the GBI to develop the first ever statewide gang database. It was actually legislated in 2010, but has never been the proverbial elephant has never been a bite of it's never been taken until now, and so we anticipate that up and running. DCS and DOC have just stood with us and been partners, and that is is ready to basically put up and to be operational. I anticipate some announcement of that nature. Again, it's not my place to set that, but I anticipate that coming up sometime before the session is over.
Explain exactly what the database is.
Yes, sir. Basically what that is, our vision for the database, and statutorily what it says is that GBI will administer a gang database. It's an informational intelligence-based system that's open to or accessible to law enforcement agencies in the state of Georgia. Our goal was to make sure that even if you were in Fannin County or Fulton County or down in Lowndes County, that an officer can access a database. For example, if he was working on Vic Reynolds, I have information that Vic Reynolds is in a gang, I'm working on him in Cobb County. Oh, look, they're working on him in Lowndes County. That's the gang agent working on it. That officer can call that agent in Lowndes County, hey, I'm working a case on Vic Reynolds, what do you have on him? We can connect those individuals. One thing we've learned, Mr. Chairman, in working gangs, unlike years and years ago, gangs do not recognize jurisdictional boundaries anymore. They were previously restrained to certain areas or kept themselves restrained. They do not do that any longer. They go across jurisdictional boundaries, and that's one of the reasons why I think GBI can be the point of the spear in the fight against gangs, because of our jurisdictional authority. And the gang database is a free, no charge, accessible intelligence platform to law enforcement around the state.
And how does that help the law enforcement agents in the field?
I'm sorry.
How does that help the law enforcement agents in the field by accessing the database and putting in Vic Reynolds or Andy Welch in the gang database and seeing that we pop up? What is that?
It does a couple of things. It permits them to, for example, if let's say that they stop me in Cobb County, they think I'm a member of a gang, I commit a certain type of crime. If they've learned that I have that I'm known in Lowndes County, and there's an investigation on me there or a previous investigation, it just gives more information to that investigating officer. There may be 404B eventual material from that, what we used to call similar transactions for non-lawyers, but 404B stuff that may be admissible against that person based on what happened in Lowndes that investigating officer in Cobb would never know. One of the things we learned as DA is we were involved in a case in Cobb where the main leader was in Baldwin County and never came to Cobb. And so without that information being out there and us gathering it, we'd never have known that. What we want this database to do is to make that as easy as possible for those officers.
Does it also provide some level of affiliations by which you can question other individuals that might be affiliated with this particular gang in that area, so that you can gain more information, more intel on those individuals?
It does. It adds that ability as well, where you can look down to another county, make some determination of whether or not that person is affiliating with the people in your county. It just connects. It's a connectivity device, and it's an informational intelligence device. And again, I think one of the primary things about it is it's free of charge and there's no cost to law enforcement. Last two items, point four is a reduction of funds for travel and supplies. We've cut our travel and investigations, as well as supplies and material, as well as what we call our evidence purchase information money to the tune of some $68,000. And the very last item, the point 4.5, is the increase for the gang task force in the state of Georgia.
Mr. Director, I will go back on the items where we're going, the Bureau Administration, line 30.1.3, you're freezing 2 vacant positions. How many other vacant positions exist within the administration?
I have those numbers for you, sir. Yeah, in administration, we have 3 vacant positions, sir.
Is that in addition to the 2 you're cutting?
Yes.
Okay. And then would those be, in looking at the FY 2021 budget, FY 2021 budget, the 2 positions you're reducing funds by, are those any of those 3 that we're talking about, or that's just a continuation of the 2? Okay, so there'll still be 3 vacant positions that are funded. Is that correct?
Yes,
okay.
Sir. Mm-hmm.
All right, so moving on to your Criminal Justice Information Services, CJIS, you have the freezing of 2 vacant positions there. How many are remaining that will be funded? that are vacant funded positions remaining.
Let me make sure I understand your question. You're referring to the column under the C, under point 2.2?
30.2.3.
Point 3, okay, I'm sorry.
There's 2 vacant positions you're freezing there, so there's not going to be any money for those positions. And my question is, how many positions are currently vacant which retain funding?
Oh, yes, sir, I understand your question. Do you have those numbers, Connie? I'm looking at our lab positions.
Okay, about 2, but you'll confirm, okay. And then looking down at the regional investigative services, well, let me go back to forensic science. How many, it's the same question, I'm just trying to discern how many vacant funded positions will be retained in your budget for forensic science services?
I'll maybe paint you a better picture for that, Mr. Chairman. In that division, we have for scientists, and I'll talk about lab techs as well if I need to, but scientists, today we have 153 scientist positions filled, 30 vacant, but we're approved for 8 more, so we'll end up, and we anticipate those coming on relatively soon. So we anticipate probably having around 22 vacant positions with our scientists.
Okay. And then same with lab techs?
Lab techs, we have 36 positions currently filled. We have 9 today which are vacant. However, we have an approval for another 7, so we anticipate that vacant number decreasing from 9 until 2.
And by approval, I mean, you're already approved to hire for 9. We've already budgeted for 9.
Yeah, that's
what approval you're talking about?
our internal approval where we've
Approved individuals to
Yes,
fill?
sir.
Okay, so they're qualified, then,
Yeah, we're basically where finance has said we have the money, we're going to hire them, we're in the process of doing it.
okay, good. So it looks like you have a balance of 2 then that,
Once that process is complete, we should have a balance of 2
Gotcha.
under lab techs that are vacant.
very good. And then in the regional investigative services, that's the same question. We're eliminating 12 vacant sworn positions and the 4 non-sworn positions, and then capturing some money for hiring delays. But how many vacant sworn positions will you continue to fund?
Again, painting with a broad brush, we have 258 currently filled sworn positions. As of today, we have 22 vacant positions, but we have 5 that fit in that approval category. So we'll have 17 vacant sworn positions once those occur.
Okay, and so that's after you've eliminated the 12, right?
Yes.
Okay, so that's the net of the 12, and the same thing for their non-sworn positions.
Well, that followed. I don't have the non-sworn. I'm sorry, we'll get that to you. Yes, sir.
All right, very good. Okay, I know we have the fiscal budget for 2021, but Representative Holcomb has a question.
Thank you, Mr. Chairman. I have a few. The 44,000 total items that are backlogged in terms of being tested, are all of those pieces of evidence that presumably will be needed for prosecutions?
Well, they certainly would assume to be that, Representative Holcomb. The reality is, as I was telling a moment ago, that out of those cases, those 44,000, about 30% of those are older, are anywhere from 2 to 6 years, and we even have a handful older than 6. What our mission is on those 30% is to make some determination relatively soon whether or not we even need to have those cases at the lab. As a former prosecutor and as a defense attorney as well, if a case, maybe with the exception of a death penalty case, those cases with that much age, the truth is, I think once we reach out and begin finding out what are you doing with this case, that case is either going to have been null pros, dead docketed, or not going to proceed. And so as one of the things I've determined is what, to some extent, and it's not maybe not the total 30%, but a chunk of that 30%, the lab has basically become a repository for holding evidence that is never needed to be tested. And so our job is to find out, in the truth, in a perfect circumstance, everything that comes in there ought to come in for that purpose of some testing to determine who did what and to prove a case or not prove it, just as importantly. And so Do I think every bit of the evidence that we have or items that we have in the lab right now fit that category? No, sir. Should they? Yes, sir.
Okay. With respect to the older evidence, and I understand what you're saying, is the decision to now not move forward and prosecute because it took too long to test it and to act upon it, or were there other factors that maybe the case itself wasn't very compelling and that's why it sort of sat around for a long time?
You know, I can answer that from when I stepped in as director, and I think I can answer for even when previously, because of my relationship with the Bureau then as district attorney and with Director Keenan, we would never have a circumstance or never permit a circumstance that we had knowledge of for our delay in testing something to stand in the way of a case. For example, I get calls relatively frequent from prosecutors around the state. Got one this week, got one last week. You know, Vic, the judge is pushing us. We need this tested. We consider that a priority item. Director Miles, who runs the lab, all I have to do is pick it up. Cleveland, this is a priority. It's done. We put that ahead. In fact, what we've become to some extent is the exception of a priority, testing priority cases over cases that come in has become somewhat where the exception has swallowed the rule. And we end up doing a lot of priority cases because prosecutors say, I need this, this is what I need. And in other cases they don't need is one of the reasons why that 30% is built up over the years, is because they haven't indicated to us that they need those tested. And our job is to find that out. But I cannot look at you and tell you that a case that a prosecutor perhaps for some reason or the other has not called us, but they all know. And I've told them in my meeting with the prosecutors, anything you need, if it's a priority to you, it's a priority to us. And we will do it and we'll put it ahead of everything else. So I would hope and pray there hasn't been any circumstances where that's happened.
Okay. A few years ago when we were starting to address, and I recognize that it's just one type of evidence, but the sexual assault kit backlog, there was an effort to look at the possibility of using vendors, and I think one of the things that was found was that across the nation action was taking place simultaneously, and so there were limitations on what the private sector, those vendors could take. Is that still an issue, or are you seeing that the private sector has more capacity and there's more potential to have outsourcing as you suggested?
We're seeing that turn toward our favor, and by that I mean we're seeing not only more private labs, we're seeing more private labs with the accreditation that makes us feel comfortable. Yesterday, the group that we already contractually have a contractual relationship with to do drug identification told me on the phone yesterday about 4:30, they have the potential now to take 1,000 cases a month. And it can turn them around in 30 days. That's staggering. And she said, you know, we want you to come and see our lab, to meet our people, but we already have the relationship with them where we've got the Coverdell grant where we're going to send them probably 1,900, 2,000 drug cases. And so if that works the way we want it to, the way we anticipate it, then I'm hoping we'll get to a point in drug identification, which is categorically our largest single testing item, is to be able to feel comfortable enough to get to a point where we're sending that to those labs. Because the truth is, and this isn't true in every case, but the truth is the majority of time, drug cases do not go to trial. They do sometimes, trafficking cases, but the majority of possession with intent cases, the only thing that's stopping the disposition is the testing. Once it's tested, if I represent a client, I'm going to tell them, we can't work out a plea for you till we know what it is. If we know it's methamphetamine, then I'll go work out a deal for you. And so that testing is usually the trigger that moves the majority of drug cases. Again, not all of them, but the overwhelming majority. And so that's to me an area that's ripe to be outsourced to private companies.
Okay. And thank you. With respect to sexual assault kits, if just one comes into the lab today and there's nothing in front of it in terms of a work priority, but just a scientist and a tech can get started on that kit, how long does it take to process that single kit?
Let me defer to my lab director. How long would you think? 10 days.
10 days, okay. And we have a backlog right now of over 700, is
Yes,
that
sir.
correct? Okay. I'll have to run the numbers and do the math, but with us continuing to have around 200 new cases a month, which is a decline because it had been 250 in fiscal years 17 and 18, and then it dropped to 200 in 2019, or calendar years rather, there is, I think, very broad support within the General Assembly to make sure that there isn't a step back on the backlog, which I know you understand and share as well. So with the reductions, can you provide some specificity in terms of the impact that it's going to have on clearing out the 700 cases and on being able to maintain a time frame like that? My personal goal, just to throw it out there, is I'd like to see these kits tested within 30 days, which gives a 20-day window off of the 10 days that it takes. I don't know if that's achievable or not, but that's something that I'd like to see us strive for, and other states have actually codified that time frame.
Yeah, one of the things I've thought about doing, and this is literally, and I hope Director Miles doesn't fall out of his seat, but this is one of the things that came to me last night and today as I was thinking about sexual assault kit cases. And I do want to share some numbers with you in a moment, because I know how hard you've worked in this area and this committee, and some numbers I think you'll be very pleased with. But one of the things that we might think about consider doing is, if we decide to begin outsourcing more DNA cases, is make a decision internally for sexual assault kits to stay with this lab. And that may give us the opportunity to turn those around in a quicker time frame. The testing of those kits and the entering into CODIS works. And,
Yes.
let me tell you how I know it works. Last year, fiscal year 19, we did 1,993 sexual assault kit tests. 1993. Out of that, we got a hit on 22% of those. 443 state offender hits based on sexual assault kits. And Representative Holcomb, out of that group, out of the 443 hits, 259 of them helped solve other sexual assault cases. That's 58% hit. 58% of the hits we got went to solving other sexual assaults. Now, the remaining 184 solved murder, burglary, theft, other cases where DNA was present. And in addition to those offender hits, we got another 36 forensic hits where, example, the DNA may hit on a piece of clothing in another case. Out of those 36 forensic hits, 21 of those, 58%, the same percentage, were sexual assault case hits. And so, you know, your work in that area, and this committee's work, and all the other legislators' work in there, it works. It's actually something that and I will tell you again, as I committed to you the other day, those cases are extremely important to me. As a former prosecutor, as a father of 2 daughters, that's something that this lab I'll commit to you, we will not allow that to become an issue. I won't allow it.
Thank you, and I'm very encouraged by that, and my sense is that those numbers will probably continue to go up, because as we continue to test and get more names or more DNA into the database, that we're going to have a bigger field to play with in terms of stopping crimes. And the last thing I want to say before I stop, and thank you for your time, is to just praise on Nellie Miles. I reach out to her all the time for information. She's always immediately responsive in a comprehensive way, and I just want to let her know that
Well,
it's
thank you. It's
appreciated.
very gracious. I do want to, speaking of Nellie and Natalie both, we held an internal poll at the GBI, and they were voted the 2 best dressed GBI employees. So we're very proud of both of them. So.
I think Representative Holcomb was trying to find you a pay raise. we have the 2021 budget to go through, and so I noticed that some of these items are going to be, I think, a repeat of the
Yes,
items
sir.
we covered in the amended. So where we touch on something that's just a continuation of that, you can just jump through those quickly.
Okay.
We're running a little bit behind time, but it's an important subject.
All right.
Did you want to go through any of those?
This is what we were advised. I apologize. We were advised that this was limited to the amended 20, but I'm so
You know,
sorry.
that's fine with me, because I am eager to have people back. And so,
I should have just marched through. shouldn't I?
Director, you have provided me with a perfect window to schedule some more hearings.
Yes.
I love this job. This is my most favorite job, and this is, and what I want to emphasize here is you came so prepared to deal with the amended budget, knowing we were going to be grilling you about the forensic scientist, and you came prepared. You had the numbers, a few of them we need to back up. But when you, Ms. Buck, when you go through that, will you look at the full budget as well on the vacancy numbers? So you can hear I'm asking the same questions of everybody throughout this process. So if you could, make sure that Courtney gets those numbers, let's get that breakdown.
Yes, sir.
And then, in addition to that, I think what we'll do is we'll come back around on the other items, and we'll have a subsequent hearing, either later in the week or the first part of next week.
Thank you, sir.
Okay, thank you very much.
Thank y'all. Appreciate your time.
All right, we'll take a 10-minute break right now. It's a good breaking point, and then we'll come back here. We'll start back up just a little bit after 3:25, 3:28, around 3:30 at the latest. We'll get started, and then we're going to go through, I think, 2 more departments that we have to hit today: juvenile justice and public safety.